Hi everyone, today we're going to talk about the difference between a hearing aid evaluation and a communication functional needs assessment. Hi, I'm Dr. 𝗪𝗃𝗏 𝗪𝗃 and welcome to another episode of the Flex Audiology Show. If you like this type of content, would love for you to hit the subscribe button as that helps us grow our channel, and I'm forever grateful because that spreads the word to other people in our area. So let's jump right in. When you've been looking, probably as you're perusing around different websites or trying to schedule a hearing appointment, you're probably going to see a couple different options that you can choose. And some places offer a simple hearing aid evaluation. That's typically if you've already had a hearing test done yourself and you just want to come in and talk about hearing aid devices. Here at Flex Audiology, we do something a little bit different. It's actually called the Communication Functional Needs Assessment, and they're completely two different type of appointments. So I just want to spend a little bit time talking about the differences. So let's talk about a hearing aid evaluation. That particular phrase really came about when insurance was involved, and typically with insurance plans, if they do offer any coverage, they usually have a very specific set of hearing aids that are covered. And so during that hearing aid evaluation, we'll take a look at your insurance, we'll go over the plan options, and for a lot of these plans, it's just simply a difference between one or two devices. So we're sitting down, we're covering the price point with you, and we're talking about what are the differences between the products that you're allowed to purchase off of your insurance contract. Many times it's really only one manufacturer as well. So even though there are multiple manufacturers, you are going to be really kind of pigeonholed into one, if you're lucky, maybe two devices. So there's really not a whole lot that goes into the hearing aid evaluation. It's talking about, do I want something over the ear? Do I want something in the ear? And then really maybe picking the color, making sure we've got the right size, we're taking an ear impression, things to really kind of try to customize it as much to you as we possibly can within the confines of that insurance benefit. So that particular evaluation is just focused on a very limited scope and really what can those particular devices do for you. When we look at stepping back to a communication functional needs assessment, we're not just looking at the basic hearing test. We want to know, how do you hear? How is your brain processing sound? Do you need the signal to be faster? Do you need it to be slower? Do you need the signal to be more vibrant? Do you need it to be a little bit more muted and focus on comfort? So in order for us to assess that, in addition to the basic hearing test, which is what's covered mostly by insurance, and typically that's what people show up at our door with. They come in and say, oh, I've been evaluated, and they have the most bare bones basic hearing test. And I understand that because it's actually called a comprehensive hearing exam, and it's like the most basic thing possible. So that's what they have. So in addition to that basic hearing test, we are looking for uncomfortable loudness levels. We want to look at your most comfortable loudness levels. We want to look at not only how do you process speech in one ear individually, but how is the interaction of speech in both ears. We also want to test you in background noise. 90% of our patients, if not all of our patients, come in and their main complaint is, I have trouble when there's multiple people talking or when I'm out in public and there's noise. So why are we not assessing how you understand speech in a noisy place? Then we're also going to look at, what are your acceptable noise levels? Everybody has a different tolerance level, and depending on where you fall, that will also kind of pivot us toward one manufacturer or another. And then also, depending on the severity of your hearing loss and how you're processing speech, the treatment may not just be devices. Now we might want to look at accessories. It could be TV streaming devices. It could be remote microphones. It could be sound therapy pillows. So depending on what we find during our consultation, we're going to tailor our treatment plan to encompass more than just hearing devices. Maybe it's not even a hearing device that you actually need. Okay, so we're going to create a personalized plan, and for a lot of our patients, there's multiple manufacturers out there. So we'll take a look at your test results, and then we might demo one or two different manufacturers just to see if you have not only a preference for the sound quality, but maybe we test you in the booth with those devices just to see how you're interacting with them. So a lot of variables can come into play within that communication functional needs assessment that we simply just do not address if you're coming straight in for a hearing aid evaluation as it's pertaining to your insurance. So hopefully you can kind of see, like, when we combine the two approaches, because some people come in for both. They still have the insurance benefit. We still need to cover that, but we will layer on the communication functional needs assessment to really get a whole picture and also to be able to create realistic expectations for you as you move forward with your insurance benefit. So we want to work with you on a deeper level, really focus on a communication, and really that starts with understanding both how your ears are working and how your brain is working. If you have any questions, please drop me a line. I will try to respond as best as possible, but just know when you come in to see Flex Audiology, that's what you're going to get here. Have a good one.